We would like to introduce our finding that activation of beta-adrenergic signals inhibits oral cancer progression. We have been working on oral cancer, which is a type of head and neck cancer located in the oral cavity. Some malignant oral cancer metastasize to lymph nodes and distant organs, which results in low mortality. Since the number of deaths caused by oral cancer increases globally, understanding the mechanisms underlying the progression and the metastasis of oral cancer is crucial. We are interested in transforming growth factor beta as a molecule which plays important roles in progression of oral cancer. TGF-beta inhibits the formation of cancer cells by inhibiting proliferation of epithelial cells. However, once tumor is formed, TGF-beta present in tumor microenvironment induces migration of epithelial cancer cells and promotes cancer progression.
TGF-beta promotes cell migration by induction of epithelial mesenchymal transition, EMT. During EMT, the epithelial cancer cells lose their cell-cell contacts and acquire mesenchymal phenotype, being migratory and invasive. At the initial stage, some cancer cells undergo partial EMT. In other words, they exhibit hybrid epithelial mesenchymal phenotype. It has been suggested that partial EMT confers cancer cells with tumor-initiating abilities and contributes to the drug resistance. We can suppress EMT with inhibitor of TGF-beta signals and induce mesenchymal epithelial transition, MET. The process reverses to EMT, during which cells with mesenchymal phenotype regain their epithelial identity. Induction of MET in squamous cell carcinoma reduces its invasiveness, suggesting that MET inducing will be beneficial for oral cancer treatment. But sometimes complete inhibition of TGF-beta signals may also induce tumorigenesis. So it's important to identify novel therapeutic agents targeting EMT without inhibition of TGF-beta signals. In our study, we have used SAS, an oral cancer cell line. These cells represent oral cancer cells that underwent partial EMT. They respond to TGF-beta and change their phenotype to more mesenchymal one. On the other hand, treatment with TGF-beta inhibitor induces MET. So we established cell-based reporter cells to screen for the compounds inducing MET. We identified isoxaprine, a drug that is used to relax vascular smooth muscles. We found that isoxaprine significantly decreases the migration of SAS cells. That was one more important thing. Isoxaprine did not inhibit TGF-beta signal. Isoxaprine is beta-2 adrenergic receptor agonist. That means it can stimulate beta-2 adrenergic signal in cells. So next we examine whether the effect of isoxaprine on SAS cells can be altered by pharmacological inhibition of beta-adrenergic signals. We used propranolol, a non-selective beta-adrenergic receptor antagonist. Propranolol almost completely abrogated the inhibitory effect of isoxaprine on SAS cells migration, suggesting that isoxaprine-induced inhibition of SAS cells migration is regulated by beta-adrenergic signals. We have also examined effect of isoxaprine on tumor growth in vivo. Administration with isoxaprine resulted in significantly smaller primary tumors when compared to tumors developed by mice administered with vehicles, suggesting tumor suppressive effect of isoxaprine. This is our take-home message. EMT induces progression of the oral cancer. First, isoxaprine suppresses oral cancer progression by inhibiting EMT. Second, beta-2 adrenergic receptor signal is a new promising therapeutic target for treatment of oral cancer. Originally, isoxaprine has been approved for the treatment of premature labor. So we can expect that isoxaprine can be developed as the drug for oral cancer patients by drug repositioning. We hope that we can deliver this finding to oral cancer patients in the near future.